everyone, Dr. Della here. I am the educational consultant at the Confidentist Institution for Internationally Trained Dentists in Canada. So we're here today with Dr. Mahbod, DDS, our head instructor for skills exam at Confidentist Institution. Hello, Dr. Mahbod.
Hi,
Dr. Mahbod. Thank you for accepting our invitation and thank you for being here today. Could you please introduce yourself for us a little bit?
Sure. I'm Dr. Mahbod. I am an international trained dentist from Iran. Before moving to Canada, I practiced almost 20 years as a general dentist.
Wow.
And I finished my direct licensing process in 2017. I moved in 2015. And right now I'm working as a dentist in Ontario.
Okay, perfect. Thank you for that. So could you please tell us a little bit about the skills exam? Like, how is it? What is this exam? And who can actually sit this exam and participate in it?
Okay. A skill exam is a clinical-based exam and consists of 12 different projects. And according to a new NDEB regulation, candidates who pass AFK and ACJ are able to, take this exam, ACS exam.
Okay, so it's actually practical exam that you have to do the projects.
Clinical,
Okay, so could you please speak a little bit about the projects? Like, what are these projects?
Currently, there are 12 projects. PFM preparation and FMC preparation, Class 2 amalgam preparation, Class 3 preparation, and provisional crown, amalgam Class 2 restoration, composite Class 2 restoration, and Class 4 composite restoration, and rubber dam, record keeping, and infection control.
Okay, and these are all on mannequins, right?
Yes, all of them, yes.
Okay, and how is this exam scored? Like, is there any specific scoring system?
Okay, recently NDEB announced that they are coming up with a new protocols. But currently, the scoring is A plus, D, and E. And A plus is passed, and E is failed. But D is, has some
In between.
yes, it's between, and also has some small and minor mistakes, but is not acceptable.
Okay, so it's like you're gonna have to get a specific amount of A's or D's to it's like a combination.
For every project, they consider 3 columns. Every columns include of A plus, D, and E. And for every project, if you want to pass, you have to get A for overall for one project. Therefore, if you get 2 A's and 1 D, this project is A.
Okay.
And if you get triple A's, is A. But if you just get 1 E in every project, the project failed. That's why it's very important to get A, at least 2 columns.
2 columns. Okay, yes, thank you. That's good to know. And according to what you say, it's not that easy to pass this exam. So, does experience matter? Like, is someone who has more experience working in a clinic has higher chance of passing this exam compared to a fresh graduate?
This exam has certain criteria that have to follow them in order to pass this exam. And in my opinion, your dedication and also hard work is more important than experience.
Yeah.
And if you work 5 to 6 days a week and for 5 to 6 months and every day 5 to 6 hours, there is a high chance to pass this exam. That's why, in my opinion, it's very important to work in your center and also in your home.
Okay, so practice makes perfect, right?
Yes.
Okay, so how has the pandemic affected the whole NDEB equivalency and specifically skills exam?
Okay. As you know, the whole world has been affected by coronavirus, and NDEB examination are not an exception. I think the last ACS exam was in December 2019, and since then we didn't have any exam, and they postponed all of these exams. That's why many people are waiting for this exam, and probably it makes the registration a little bit competitive.
Oh, I see.
In the future, yes.
Yeah, okay, thank you. So it's going to be a little bit hard for the future students to get through it. I know that there has been some changes announced by the NDEB recently. Do you know anything about it? Could you please share a few words about it?
To be honest, there was an interview released by NDEB president, and I think it's better to watch this interview.
Yeah.
And you will have clear idea about the changes in 2022.
Yeah, I have seen that interview. We have actually posted a link of the interview of Dr. Richardson's on our Facebook page, so everyone can have access to it from there. So a very popular question that I usually get is that it's about the instruments and materials that we are going to use in this exam. So we know that there are a lot of things that we need. So could you give us a little bit of summary of what we need, and also if we can bring them with us from our home country? Do we have to buy them here?
There is a list of material and instruments which are provided by Confidentist group for our student, and usually we offer some of these to our student, and in my opinion it doesn't matter where you get them from.
Oh, okay, so there is no difference in quality or...
No.
Okay.
All of them is the same.
Okay, good. Thank you, because that's been a question of a lot of people, yes. Countless. So you said that there are a lot of people are already stuck behind this exam because of the pandemic and cancellations of the exam. So do you have any advice for these people?
In my opinion, they can keep working very lightly in order to maintain their skills. But honestly, until and unless they don't release the new protocol, we cannot say certainly in the future they add the new project or not, and the pattern of the exam will be changed or not.
Oh, so you think that might happen, that they change the project?
Maybe any changing, yes.
Okay, so we'll see. I think the new protocol is going to come out in October. Yes. So I think we'll know for sure by then. So I think that's all of my questions. If there's anything that you think that has been left out or any advice that you have for the NDEB participants, please share it with us so we can use your experience.
The direct licensing path is very predictable and doable if you put enough time, and don't disappoint it if you fail in this exam for one time, for example. And the last word, stay focused, stay positive, and never give up.
Thank you. I totally agree with you. Thank you very much for coming here today and putting the time and effort. It's been really nice meeting you. Thank you for watching, everyone. I hope that we were able to address all your concerns and questions about the skills exam. If you have any further questions, please don't hesitate to contact us. You can comment, message. You can also always be upgraded with the new information, the new news with our social media, Facebook or Instagram. Thank you again, Dr. Mahbod, and have a great day.
Thank you so much for having me. Thank you. Bye-bye.